And can I thank colleagues for their contributions here today. It's clear that the matters provided for in the bill are of great interest to members right across the House, and many issues have been raised during the debate with a range of views and a range of insights shared. There are members of the House who believe that restrictions should be relaxed more quickly and that we should open up more quickly. There are those who believe that the provisions here are a safe way forward for reopening the sector. And there are those who believe we should keep the entire sector closed for many months to come. There are some views being put forward, I think led by Sinn Féin, saying that we can open for everybody, but we can do so safely. I would put it to the House that that is totally disingenuous, that we can have our cake and eat it. At least those who, like Deputy McNamara, who are, I think, and others who are proposing we open up, I think some of them are accepting that their proposals would lead to an increase in the number of people who would die. And I think at least some of the groups who've said we should keep everything closed are accepting that the entire hospitality sector should stay closed for several months. The view that we can open it up now in an accelerated way for everybody and that that's safe, I have to say is utterly disingenuous, and I really do believe that that is Sinn Féin speaking out of both sides of their mouth. Should this bill be passed, it's my view that we'll have taken a sensible and balanced approach to the challenges still posed by COVID-19. With regards to the hospitality sector, I believe the bill achieves the best possible balance between what is a very understandable desire on the part of the sector and the public to resume normal activities and the very sound principles of public health and the public health advice which we have. As the House is aware, clear and concerning public health advice led government to pause the planned easing of measures. We are, of course, keen to see the safe resumption of normal social and economic life, and I'm very conscious of the sacrifices that have been made by everyone over the past 17 months. And at the same time, our society has borne these difficult times with amazing solidarity and togetherness. We've protected the most vulnerable. Our health system has been protected to the greatest possible extent, and that will continue to be our shared goal. It's now more than 16 months since the first case of COVID-19 was confirmed in Ireland. Since then, there is nobody in the country who hasn't been affected in some way by the consequences of this disease, and not a single person who has not been asked to make a sacrifice in this unprecedented national effort. The disease has had an impact on morbidity and on mortality, on our way of life, on the lost opportunities for making significant life events, marking significant life events. Most positively, as I've mentioned, the vaccine rollout has continued apace. Over the last week, we have one of the highest rates of vaccinations anywhere in the world. And this week, we will hit a fantastic milestone of administering our 5 millionth vaccine dose. The City West Vaccination Centre reached 250,000 vaccine doses earlier this week. And to all our vaccinators and volunteers right across the country, I want to say thank you for everything you've done and you continue to do. We can't afford to become complacent in the face of this virus, but we do have a clear pathway to gradually move out of the restrictions that it has necessarily imposed. The proposals we're discussing this evening have been brought jointly forward by the Taoiseach and Minister for Enterprise, Trade and Employment and the Minister for Tourism, Culture, Arts, Gaeltacht, Sports and Media in consultation with their sectors and union representatives. I know that these departments are working with the sectoral bodies on producing the necessary guidelines and protocols which will be available shortly and in advance of the date of opening. In the remaining time available to me, Ceann Comhairle, I'd like to address some of the issues that have been raised by colleagues through the debate this evening. But one word that has kept coming up is the word solidarity, and that we need to show solidarity. I would like to ask the question in a different way. We have an opportunity here to get people back to work, people who have been out of work for an awfully long time and who have suffered terribly because of that. And we have public health advice that says we have an opportunity to get these people back to work. They want to get back to work. And we have an opportunity to do it safely. Now, that opportunity means that those who are vaccinated or who have recovered can go indoors. And so we've a choice. To me, the act of solidarity is us all saying whether we are vaccinated or not, because we'll all very shortly have the opportunity, and it's now open to all groups from 18 up. The act of solidarity would be saying whether or not I can go indoors just yet, because I'll be able to in a few weeks if I can't now, but whether or not I can, we have to give people the opportunity to go back to work. The alternative is to say, because I can't avail of it, nobody should be able to avail of it, and people should not be able to avail of the opportunity to go back to work. I think the act of solidarity is saying, let's get people back to work. Regardless of the impact it has on an individual in the short term, I believe that's solidarity. The question has been raised around discrimination, but we already differentiate in terms of public health measures between people who are vaccinated and unvaccinated in terms of international travel measures. The entire EU digital COVID certificate is based on vaccination status. And there are additional measures that people have to take if they don't have that vaccination or testing status. So we've already accepted, and many of the deputies here who are saying we can't differentiate based on health status, they didn't raise any of these issues or any of these concerns when it pertained to international travel. So the principle is there, and it's about what's safe. You know, we don't allow smoking in pubs and restaurants, we do allow it outside. Because for the people in the pubs or restaurants, it's not safe for people to be smoking in there. We allow people who are aged 18 and over to drink alcohol in pubs or restaurants. We don't allow people who are under 18 to drink alcohol in pubs or restaurants because we deem it to be not safe based on public health grounds. And this is the same. It's about saying if we follow the current guidelines, it will be safe for the people inside, it will be safe for the staff. And that's what this is about. It's about what's safe and unsafe. And I believe if we have an opportunity to get an awful lot of men and women back to work, that we need to take that opportunity. And that's what we're doing here, and we're doing it here safely. Some colleagues asked, are other countries using the EU digital COVID certificate for dining? And they are. Greece, Portugal, Austria and Denmark are currently using it, and there's additional countries, including Germany and others, who are using other verification, but essentially the same process. And the EU position has been that national governments are free to legislate for domestic use of the EU certificate, which we're doing and other countries are doing. I think some very reasonable questions have been asked around verification. That is being worked through with the industry at the moment as to what the most appropriate method for verification is. People have raised very legitimate concerns around staff. Are staff going to be safe? I can assure colleagues that the Chief Medical Officer has reiterated today again that if the protocols are followed, then it is safe for staff, and we know that staff are already working in this situation in hotels. I think some really good points have been raised about ventilation, and it's a really important part of our response. There is an expert group has been set up. There are now several expert reports, and I can share with colleagues that at a senior officials level within government across departments and state agencies, very substantial advice is being brought to bear to create guidelines sector by sector to make sure that we are using the advantages that good ventilation bring when dealing with this disease. Some colleagues have asked, does the bill facilitate the future use of testing? Yes, it does, both PCR testing and antigen testing. Colleagues have asked if the measures here will be enforced, and they will be enforced and they can be enforced, but I think it's important to say that primarily it's about trusting people to do the right thing, and that's been a common thread right from the start. So we've had regulations around face masks and all sorts of other things, lots and lots of different things. And you know, the number of people who could meet up in houses, the number of people who could meet up in gardens, and we've never had to rely on widespread enforcement because people recognise that this is public health advice that's keeping themselves and others safe. and that I believe will be the same thing here. And then finally, I know I'm out of time, Ceann Comhairle. I'd just like to thank those who helped make the proposals, turn the proposals into legislation in such a short time, and thank in particular the Attorney General and his staff who've worked tirelessly, as well as officials from other government departments. I'd like to thank the House, the Bills Office, the Whip's Office, the Business Committee for scheduling the bill, and the Health Committee for its assistance in waiving pre-leg scrutiny. And can I say, I acknowledge the concerns raised by deputies around how quickly this has been brought through. This is not how we normally conduct business in the Oireachtas. We all know that. It's not the way that any of us would. It's not the way that any of us would like to conduct business.
Thank you, Minister.
And it is solely, Ceann Comhairle, Ceann Comhairle, in response to a very rapidly moving variant that we also have to move.
It's been 18 months.
To bring in measures to keep people safe.
Minister, thank you. Yes.